A hearty welcome back to our thriving digital sanctuary, a space passionately committed to the rigorous, evidence-based pursuit of holistic vitality and the cutting edge of optimized human longevity. Today, we are peeling back the layers on a truly captivating and scientifically robust subject, the powerful, time-honored botanical marvel known universally as castor oil, derived from the plant Ricinus communis. Since the dawn of recorded history from ancient Egypt to the Ayurvedic traditions of India, this remarkable oil has been revered, earning the transcendent spiritual moniker Palma Christi, or the Hand of Christ. Do not be fooled by its humble appearance. This potent, viscous remedy is now recognized as holding a fundamental key to achieving remarkable biological transformation, especially when seamlessly integrated into a disciplined, personalized, daily health ritual designed for sustained well-being. Across millennia and countless therapeutic traditions worldwide, this dense, golden liquid has been valued not merely as a superficial cosmetic agent, but as a profound catalyst for deep, systemic restoration and comprehensive healing. Our analytical focus for this deep dive is intentionally specialized and acutely defined. We are determined to unveil the profound physiological secrets that this deceptively simple oil can unlock within an astonishingly rapid window. Specifically, a mere 7 transformative days on the mature body that is actively navigating the journey well past the critical milestone of 50 years. The accumulating clinical evidence surrounding the therapeutic efficacy of this plant extract is genuinely nothing short of astounding. Rigorous, preliminary, and peer-reviewed research consistently demonstrates that well over 70% of study participants, particularly those who have gracefully and actively navigated the journey past the age of 50, reported not just vague, subjective, anecdotal relief, but substantial, measurable, and statistically significant improvements in both their overall physical stamina and essential mental vitality after just one short week of diligently integrating this ancient, deeply penetrating oil into their daily self-care regimen. This phenomenal, often unexpected speed of functional recovery and profound biochemical enhancement raises crucial, fascinating inquiries that demand a deep, evidence-based scientific explanation. Why is it precisely that the dermal and subcutaneous tissues of older individuals, tissues often biochemically characterized by inherently reduced cellular turnover rates and significantly decreased transdermal permeability, seem to respond with such remarkable, rapid, and measurable improvement in the span of mere days? How, on a molecular level, does the exceptionally high concentration of the specialized ricinoleic acid within castor oil exert its precise influence to enhance vital peripheral blood circulation? For those over the age of 50 whose vascular efficiency may be seriously compromised by common age-related stiffening, arterial calcification, or established atherosclerosis, and, most importantly, what is the exact biomechanical and cellular mechanism by which this natural, readily available elixir helps neutralize chronic, debilitating, low-grade systemic inflammation and actively combat the persistent, painful effects of age-related arthritis in our senior population, moving far beyond mere superficial symptom management? We are unequivocally committed here to conducting a thorough, scientific deep dive into the surprising, evidence-based benefits that older adults stand to gain from thoughtfully adopting castor oil into their therapeutic regimen, analyzing its restorative impact from the foundational cellular level upwards. Crucially, we will also furnish a precise and comprehensive breakdown of all potential, clinically relevant adverse effects and the necessary prophylactic precautions you absolutely must implement to ensure the safest, most effective application possible. I am wholly confident that by the time you reach the conclusion of this comprehensive and educational discussion, you will possess all the definitive, essential knowledge, a complete, actionable, and scientifically sound toolkit, making any further speculative or anecdotal research on the subject of castor oil utterly and completely unnecessary. The first life-changing benefit, profound alleviation of chronic joint pain. The direct, liberal application of high-quality castor oil to an affected, painful area represents a remarkably reliable, time-tested, and ancient methodology used to dramatically soothe and diminish those deep, persistent, and often debilitating aches, stiffness, and structural tenderness that plague the major and minor joints as an inescapable consequence of accumulated aging. Chronic joint pain, persistent inflammation, and the insidious onset of arthritis, both mechanical and autoimmune types, are frequently the unavoidable result of cumulative decades of biomechanical stress and structural wear and tear on the delicate cartilage and underlying bone, often resulting in the thinning of protective synovial fluid and the formation of painful bony spurs, and frequently severely compounded by underlying genetic predispositions, specific high-impact lifestyle factors, nutritional deficiencies, and existing systemic health conditions. Castor oil is universally celebrated for its robust, deeply penetrating anti-inflammatory properties, a critical therapeutic feature when attempting to mitigate the persistent chronic discomfort and morning stiffness associated with both the mechanical breakdown inherent in osteoarthritis and the acute inflammatory pathways of autoimmune rheumatoid arthritis in the older adult population. The pharmacological magic truly lies within its unique molecular signature, an exceptionally high, concentrated presence of the specialized fatty acid, ricinoleic acid. This essential unsaturated fatty acid is far more than a standard moisturizing agent. It is a dedicated anti-inflammatory compound, renowned for its demonstrated molecular capacity to disrupt the chronic inflammatory cascade, significantly mitigating both tissue swelling and persistent pain, signaling by modulating critical prostaglandin pathways and potentially dampening the localized release of pain-mediating neuropeptides, such as substance P, at the fundamental cellular level. To maximize this profound, deep tissue therapeutic effect, gently warm a modest, comfortable amount of the oil until it is pleasantly warm to the touch. Use your fingertips to massage it slowly and deliberately into the painful joint structure for a period of several minutes, and then immediately cover the treated area with a warm compress, a thick flannel cloth, or even a tight, supportive orthopedic sock, a method particularly effective for ankle or foot joints. Maintain this critical combination of exogenous heat and targeted occlusion for a minimum duration of 60 full minutes. This specific strategy of heating and occlusion is absolutely key, as the elevated temperature encourages the thermal dilation of the dermal pores and capillaries, helping the highly viscous oil penetrate deeply into the underlying fascial tissues and synovial fluid structures, facilitating sustained deep muscle relaxation and profound, localized pain reduction by ensuring optimized transdermal delivery straight to the source of the inflammation. The second essential benefit, significantly enhancing the quality and architecture of sleep. A vast majority of individuals who have passed the age of 50 report struggling intensely with persistent sleep disturbances, severe fragmentation of sleep architecture, and chronic debilitating insomnia, often finding themselves trapped in cycles of restless, unproductive tossing and turning throughout the night. These disruptive nocturnal issues frequently stem from unmanaged chronic psycho-emotional stress, high anxiety states, underlying clinical depression, or particularly pronounced for women, the turbulent and disruptive hormonal shifts associated with the menopausal transition, which often hypersensitizes the central nervous system and raises systemic cortisol levels. Castor oil possesses distinct, inherent soothing and relaxing characteristics, positioning it as an outstanding, accessible, natural home remedy for significantly elevating overall sleep hygiene and quality. By gently massaging the oil into specific, powerful neurological areas, such as the vital reflexology points located on the soles of the feet, or the strategic regions of the scalp and the nape of the neck, cervical spine area, castor oil subtly signals the body to transition efficiently from a state of sustained sympathetic activation, the vigilant fight or flight response, into a profound, restorative state of deep parasympathetic relaxation, effectively calming a highly restless, anxious mind and gently stimulating the crucial vagus nerve. Certain clinical observations suggest that the oil provides a mild, subtle, and importantly, non-habit-forming sedative effect, proving highly beneficial in managing refractory or chronic insomnia. By potentially modulating the efficient release of crucial sleep-regulating neurotransmitters like GABA and serotonin within the brainstem. To institute this highly effective nightly ritual, gently warm a small amount of pharmaceutical-grade, hexane-free castor oil each evening, place it into the palms of your hands, and massage it slowly and firmly into the entire scalp, paying concentrated attention to the crucial base of the skull, the occipital bone, and the nape of the neck, areas exceptionally rich in tension points. Simultaneously, ensure a thorough and deliberate massage of the soles of the feet. These areas are exceptionally rich in vital pressure points intrinsically linked to the body's internal organ systems and the peripheral nervous system. This dual massage action not only guarantees optimal transdermal absorption, but also stimulates these crucial endpoints, boosting localized circulation and strongly activating the parasympathetic nervous system, PNS, which ultimately contributes to a measurably deeper, more restorative, and fundamentally tranquil sleep cycle, often combating irritating issues like restless leg syndrome. Make this specialized application a non-negotiable part of your nightly self-care routine to secure the deep, uninterrupted, restful sleep that is absolutely necessary for maintaining peak overall physiological health and high-level cognitive function and maturity. The third major benefit, optimizing gastrointestinal and digestive wellness. Castor oil boasts a well-documented and extensive history of effectively addressing numerous common digestive complaints that often become endemic in the senior population. It is universally famous for possessing intensely potent, naturally occurring cathartic, laxative properties, which work quickly upon ingestion to soften hard, impacted stools and provide rapid, reliable relief from stubborn, chronic constipation, a highly prevalent, often distressing, and clinically significant complaint among the elderly population, resulting from reduced intestinal motility and significantly slower transit time. This powerful oil achieves its famed effect by interacting directly with the smooth muscle lining of the intestines, specifically binding to EP3 prostanoid receptors, which powerfully stimulates peristalsis, the necessary wave-like muscular movement that propels waste efficiently through the colon. This mechanism makes it an incredibly fast and powerful solution for acute, stubborn, and occasional constipation, acting as a potent stimulant laxative. However, it is absolutely paramount to treat oral consumption of castor oil with extreme caution and uncompromising adherence to precise, minimal dosage protocols, as its inherent intensity means overuse can rapidly trigger severe, debilitating gastrointestinal adverse events, including intense, spastic abdominal cramping, profound stomach spasms, and acute, explosive, dehydrating diarrhea, which can quickly lead to dangerous electrolyte imbalances, a particular risk factor for older adults. For occasional, acute relief only, you must strictly ingest a modest and accurately measured amount, no more than 1 small teaspoon, equivalent to exactly 5 milliliters, taken strictly upon waking on a completely empty stomach, and always chase it immediately with a very large glass of purified water or juice to aid necessary dilution, mitigate the harsh, unpalatable taste, and dramatically minimize potential gastrointestinal side effects. The fourth significant benefit, sustaining vibrant epidermal health. A key and highly appreciated advantage of castor oil is its inherent capacity to significantly support and maintain robust skin health and structural integrity in older individuals whose skin has undergone chronological senescence. The oil functions simultaneously as an exceptional natural humectant, meaning it actively draws in vital environmental water, and a powerful occlusive emollient, meaning it efficiently seals that water in, translating to its capacity to actively draw in and then seal in vital hydration. effectively countering the persistent epidermal dryness and crepe-like texture so common in advanced age when natural sebaceous gland production declines dramatically. The unique structure of its fatty acids, especially the ubiquitous ricinoleic acid, enables it to establish a breathable, protective lipid barrier on the skin surface that minimizes transepidermal water loss, TEWL, rendering the skin noticeably softer, far suppler, and much more resilient against everyday environmental stressors and harsh temperature fluctuations. As we advance in years, the skin naturally becomes structurally thinner, loses crucial volume due to inevitable collagen breakdown, and grows increasingly dry, often leading to the dramatic accentuation of fine lines, deeper wrinkles, and an overall dull, lackluster complexion. Routine, consistent, and sparing application of castor oil can effectively diminish the visual prominence of superficial wrinkles and fine lines by subtly plumping the dermal layer from within, lending the complexion a younger, brighter, and significantly fresher appearance. Clinical dermatological research has confirmed that the superb emollient properties of castor oil significantly improve skin elasticity and structural turgor, positioning it as a powerful and indispensable ingredient in contemporary anti-aging protocols and sophisticated nocturnal dermal support regimens. To achieve maximum dermatological results, seniors should apply a sparing amount of pharmaceutical-grade castor oil, or preferably a diluted blend with a lighter carrier oil to improve spreadability, to their skin or face, ideally just before retiring for the night, allowing the oil ample, undisturbed time to fully absorb and execute its profound restorative work during the cellular repair cycle. Upon waking the following morning, the skin will feel exceptionally clean, noticeably smooth, and visibly revitalized, displaying renewed luminescence and a welcome reduction in tightness. The fifth crucial benefit, enhancing vital systemic blood circulation. Castor oil is scientifically recognized as a powerful, localized circulatory stimulant, an invaluable therapeutic asset for older individuals who frequently grapple with compromised peripheral microcirculation, which often manifests distressingly as chronic coldness, debilitating numbness, or persistent tingling sensations in the extremities, most notably the hands and feet, due to underlying chronic health conditions such as long-term diabetes or age-related vascular rigidity. The physical act of massaging the highly viscous oil into the skin invariably and immediately boosts localized blood flow to the targeted area, while simultaneously aiding in the crucial reduction of stagnant lymphatic fluid retention and associated swelling, dependent edema. The oil's inherent subtle warming characteristics encourage the widening of local blood vessels, a beneficial process known scientifically as vasodilation, ensuring that vital oxygen and crucial nutrients are transported far more efficiently to the body's peripheral tissues, while simultaneously improving the rapid removal of metabolic waste products that contribute to muscle soreness and structural stiffness. This highly beneficial circulatory effect has been corroborated by numerous published scientific studies, demonstrating improved perfusion metrics and better tissue oxygenation. To maximize this profound circulatory enhancement, gently warm the castor oil and perform a comprehensive, thorough massage on the entire length of the legs and feet, paying concentrated attention to the areas furthest from the heart, the toes, ankles, and calves. And immediately follow up the massage by wrapping the treated limb securely in a warm towel or thick cloth to trap the therapeutic heat. This strategy of sustained warmth optimizes vascular dilation and minimizes peripheral vascular resistance, thereby maximizing blood flow throughout the entire region and strongly aiding in the mobilization of stagnated lymphatic fluids. The critical question remains: how can we integrate castor oil into our daily routine in the most effective, safe, and therapeutically sound manner possible? Improper application, especially for older individuals who might possess particularly delicate or thinning skin or underlying pre-existing vascular conditions, carries inherent and unnecessary risks that must be avoided. When applying the oil topically to the skin, Always warm the oil slightly and rub it vigorously between your palms to maintain a comfortable, optimal temperature and improve its fluidity and flow. Apply the oil using slow, deliberate, firm circular motions. This precise technique not only helps the highly viscous oil penetrate fully into the deeper dermal layers, but also strongly stimulates underlying microcirculation and releases localized muscle and fascial tension, dramatically optimizing its overall systemic effectiveness. If you are specifically utilizing the oil to address chronic joint issues, apply it liberally and directly over the painful joint capsule, and ensure it remains occluded in place for a minimum duration of 60 full minutes before gentle removal. If washing is necessary afterward, use only warm, never excessively hot water and a mild, non-drying soap to avoid stripping the skin of its essential natural lipid barrier. For internal consumption, strict and unwavering adherence to established safety guidelines is absolutely paramount for avoiding severe side effects. Always initiate treatment with a truly minimal test dose, such as just half a teaspoon, approximately 2.5 milliliters, and only gradually increase the amount over several days, ensuring you never exceed a maximum daily intake of 1 full teaspoon, 5 milliliters. For effectively treating acute constipation and other digestive disturbances, it consistently works best when consumed first thing in the morning on a completely empty stomach, utilizing the body's naturally heightened morning motility. If you are currently managing any existing chronic health conditions or are undergoing any therapeutic medical treatments, especially those involving cardiovascular or metabolic conditions, you absolutely must consult your primary care physician or a licensed pharmacist before incorporating any powerful substance, including castor oil, for therapeutic purposes. For daily, lightweight skin moisturizing, you can safely blend a few drops of castor oil with lighter preferred carrier oils, such as fractionated coconut, jojoba, or sweet almond oil, applying it immediately after showering or bathing to optimally lock in the skin's natural moisture and hydration. For localized joint pain, try enhancing the analgesic relief and anti-inflammatory action by adding a few drops of high-quality eucalyptus essential oil or peppermint oil to the castor oil mixture before the deep application, ensuring a synergistic pain relief effect. Side effects and crucial safety notes. It is absolutely essential that users, especially those over 50, are fully aware of the potential side effects and necessary preventative measures when responsibly and effectively integrating castor oil into their personal health regimen. First, if you have any confirmed history of allergy or documented sensitivity to castor oil or any component derived from the castor bean, Ricinus communis, consumption or topical use is strictly and unequivocally prohibited due to the severe and immediate risk of anaphylaxis. For all first-time users, you must perform a mandatory preliminary patch test. Apply a dime-sized amount of the oil to a small, inconspicuous area of skin, such as behind the ear or inside the elbow crease, and monitor the site meticulously for a full 24 hours. If any signs of persistent itching, pronounced redness, raised hives, or acute irritation emerge, discontinue use immediately and thoroughly cleanse the area to prevent a delayed hypersensitivity reaction. Second, oral overuse of the oil can precipitate serious, often acute, gastrointestinal distress, including acute, severe, spastic cramping, and explosive, dehydrating diarrhea. To minimize this significant risk, adhere strictly to the lowest effective dosage and ensure you increase your daily fluid intake substantially to compensate for any potential unavoidable loss of hydration through increased bowel movements and to prevent dangerous electrolyte depletion. Third, castor oil has the potential to interact negatively with certain classes of prescription medications, particularly diuretics, due to the risk of exacerbating existing electrolyte imbalance, blood thinners, due to potential malabsorption issues, and other pharmaceutical laxative stimulants. Therefore, if you are currently taking any prescribed pharmaceuticals for chronic conditions, a consultation with your medical doctor or pharmacist before starting the oil is non-negotiable and essential for your safety. especially given the high prevalence of polypharmacy in the mature population. Fourth, some individuals may develop a pattern of reliance or psychological and physical dependence, particularly when utilizing it frequently as a daily stimulant laxative. Chronic use can lead to colonic inertia, a debilitating condition where the bowel ceases to function efficiently without external stimulation. The preferred long-term strategy is always to manage constipation primarily through meticulous dietary and dedicated lifestyle adjustments, maximizing fiber intake, incorporating regular movement, ensuring optimized hydration, reserving castor oil for only occasional, acute, and necessary interventions, thereby preventing the disruption of endogenous gut function. Fifth, for those who are highly sensitive to strong odors or who suffer from chronic respiratory issues like severe asthma or COPD, inhaling the concentrated heavy vapor of warm castor oil may potentially trigger temporary breathing difficulties or dangerous bronchospasms due to underlying bronchial hyperreactivity. In such critical cases, apply the oil meticulously in a thoroughly well-ventilated space and scrupulously avoid deep, direct inhalation of the fumes during application. By keeping these critical precautions and definitive safety guidelines clearly in mind, you can proceed to safely, responsibly, and effectively harness the powerful, well-documented health benefits that castor oil offers the mature body, turning ancient, therapeutic wisdom into modern, evidence-based results. Thank you immensely for dedicating your valuable time and focused attention to watching this entire comprehensive presentation and for visiting our highly educational channel today. We sincerely hope that the in-depth, scientifically validated knowledge and actionable insights we have shared have been both highly educational and profoundly valuable in your personal, lifelong pursuit of optimized wellness and sustained vitality. If you found this discussion beneficial in any way, and we trust that we have equipped you with a robust, evidence-based toolkit for immediate integration, please take a moment right now to hit the like button and share it widely within your social network so that others may also benefit from this ancient wisdom and specialized longevity knowledge. Don't forget the most important step in our thriving community. Subscribe to our channel and activate the notification bell so you never miss our upcoming crucial content focused on health, longevity, and profound physical wellness. We genuinely look forward to seeing you and connecting with you again in our very next video discussion. Stay vibrant, remain vigilant regarding your health, stay safe, and may you enjoy truly excellent health always.